thank you for joining us today. This is the Cook County Health and Hospital System. If you need an appointment, you can call the Cook County Health and Hospital System at 312-864-0200. We're thrilled to be joined today with Dr. Stephen Axe, who's an emergency medicine physician and toxicologist with Cook County Stroger Hospital. Dr. Axe, thanks for coming today.
Pleasure to be here.
So you may know that March is National Poison Prevention Month. So we're thrilled to have Dr. Axe here to talk about some common things that he sees in the emergency department that are risks for poisoning. Dr. Axe, what do you see in the ED that people should be aware of when it comes to preventing poisoning in their household?
Well, we see all kinds of things in the emergency department. We see anything from overdoses of prescription products, things like acetaminophen or aspirin. Those are very common. In probably the most common thing we see are children getting into all sorts of chemicals or other products. And I think it's not so much we see in the ER, but what people should think about in their own home. People should really try to do their best to poison-proof their home. There are a lot of hazards in bathrooms, kitchens, those sorts of places, under cabinets, cleaning products, things like that people should be aware of. They could be hazards for toddlers.
What are some of the key medications that people might have in their home that they should be really aware of and keep out of the reach of children? You mentioned Tylenol, aspirin, things like that. Those can be dangerous if taken too often or in too large of a quantity.
Sure. Pretty much any prescription medication, everyone should be very careful with. One thing we really want people to think about, particularly grandparents who have their pills in those organizers. Small children, grandchildren, for example, can get into those, and if they have things like heart medications, blood pressure medicines, diabetes medicines, those can be really dangerous for kids if they get into it. And also, everyone should just review what's in their medicine cabinet, even things like Tylenol and aspirin. Those can be dangerous if taken in large quantities.
Now, we have talked about the Illinois Poison Center being a great resource for people. It's available 24 hours a day, 7 days a week. It's a free call. You can talk to an expert if you've got any questions about someone who's been exposed to a poisonous substance. The phone number for the Illinois Poison Center is 1-800-222-1222. And you can call anytime to talk about exposure to different medications, household chemicals, plants, insect or animal bites, and there's no cost to call. Dr. Axe, physicians even call the IPC too, right?
Yes, so it's both for the general public and also the Poison Center fields calls from hospitals throughout the state of Illinois. So the Poison Center provides a great resource for very sick patients, as well as call from home. People should use this very liberally. If you have any question about an exposure in the house, if someone gets into something at home, you should just have that number on your refrigerator.
And again, that number is 1-800-222-1222. They're available 24 hours a day, and it's a free phone call. Dr. Axe, is there anything people should know in particular about the Illinois Poison Center or how to use it?
Yeah, I guess what might be helpful for people to know is who's answering the phone when you call. So when you call the Illinois Poison Center, you're going to speak to either a pharmacist, a nurse, or maybe a physician, and they really know their stuff. So if you call in with a question, chances are they've heard it before, they've seen it before, and they can usually give you very prompt advice on what to do, what sort of measures to take. And then if it's a really complicated case, they sometimes refer calls to a group of physicians, a bunch of toxicologists, who can also consult with hospitals throughout the state for the more serious cases. But again, one thing is just when you call, there'll be a phone tree. Just hang in there, make sure you get to the specialist, and they'll give you great advice.
Excellent. And hopefully by calling the Illinois Poison Center, you could prevent a visit to you in the emergency department that may be unnecessary.
Yeah, absolutely. I mean, one of the great things, just from a public health cost perspective, the Poison Center saves millions of dollars per year in terms of unnecessary emergency room visits. Obviously, in the ER, we will see anyone and anything that walks in. But if you call the Poison Center, you'll save a trip to a hospital or a doctor's office potentially, and that's really worth your while. So it's a service that's worth tapping into.
Now, at the Cook County Hospital system, IPC and experts like yourself help train doctors of all disciplines in toxicology and poison prevention and treating people who have been exposed to various substances. Is that right?
Yeah, that's right. Since about 1988, our group called Toxicon, we have been training all of the emergency medicine residents in training, also other residents, medical students throughout the Chicagoland area and some from all over the country. And we've trained more than 1,000 residents, more than 500 medical students. So, it's great. A lot of practitioners who are out there all over Illinois and elsewhere really know their stuff.
Excellent. So in addition to poison prevention, you are an expert in illicit drugs and opioids. So we hear about that all the time on the news, that there's an opioid crisis in our country. Can you explain for us what is an opioid?
Sure. One of the things that is really just amazing is how this is a new epidemic that we're facing, the opioid epidemic. So opioids are basically anything from street drug that contains something like heroin or prescription products that are pain medications that contain things like hydrocodone in them. Mm-hmm. So you might get a prescription for an opioid after a painful procedure, a surgery, and you absolutely want to take it after you have that kind of procedure. The thing to realize is if you wind up taking these medications on a long-term or chronic basis, they do have the potential for you to become addicted. And unfortunately, in the country right now, we have more and more people who have been addicted. So people that go for surgery or something should not be afraid of using these in the short term, but we all need to be aware of the addictive potential and work with our doctors so that we have a plan to not take them too long.
Great advice. How do opioids impact a person's brain?
So opioids, basically, they work on a specific part of the brain. It's basically a pain center. And what's interesting about opioids, that pain center intersects with reward centers. So also we find people with some issues like depression or other psychiatric problems. These things are closely aligned. So sometimes we find people who are susceptible to addiction have problems in that area as well. But basically they act on the pain centers in the brain to take away the pain.
What do you see in the emergency department related to opioids? What kind of treatments do people need, either if they overdose or if they come in with other conditions that might be related to an opioid use disorder?
Sure. So probably the most common scenario we'll see after someone takes too much of an opioid is an overdose situation. And there is really a life-saving medication called Naloxone out there. And if a patient comes in with a big overdose from an opioid, we can give them the naloxone and they'll just wake right up. We have to make sure that they're breathing adequately and that they come around to full consciousness. Other times we see patients with substance use disorder that come in for a whole variety of other problems. Sometimes if someone uses street heroin, they might be an injection drug user and they could develop soft tissue or skin infections we call cellulitis. People who do this chronically develop other infections like HIV, hepatitis C, and infections in the heart, endocarditis. So we see a whole range of problems related to this.
Have you seen an increase in the number of cases in the emergency department?
Yeah, we absolutely have, and we've been tracking the numbers through the health system. Back in 2006, we saw roughly 1,000 cases, and then by 2016, we were up to around 6,000. So we've just seen it just go up and up and up.
When you mentioned naloxone, that has been touted as a life-saving drug, the antidote for an opioid, overdose, whether it's a prescription opioid or an illicit opioid like heroin. How does that work?
So naloxone, or also known by its trade name Narcan, it basically goes in, and we talked about the opioids work in the part of the brain that attacked your pain center. Well, this is what we call a competitive inhibitor. It means it competes for that same site of action, and it will push the drug right off of those receptors. So if someone's overdosed on heroin or another opioid, you give them Narcan, naloxone, and it's just going to push it right off, and those effects will go away.
Is that a treatment that people can use for, ongoing addiction? Do you see people using it frequently, or is it something that we don't want to use too often?
Yeah, no, that's a great question. So historically, naloxone was a drug we only used in the emergency room, or we would use in ambulances when people were coming to the hospital. What we've learned, though, is because the opioid epidemic has gotten so big that we're actually even prescribing naloxone for people to go home with. So we're giving it to both patients with substance use disorder, their family members, loved ones, friends, etc., so that if someone witnesses an overdose, they can basically help them get to recovery or to other help. The thing to realize about the naloxone is it's not a cure, it's not a definitive treatment at all. It's really a way for them to live another day until they can get to care. What you really want them to get to is a place where they can get all kinds of support services, what we call wraparound services, also get into MAT, medication-assisted treatment. And there's a variety of treatments we can use for people with chronic substance use disorder, and it will help them, they'll be on those medications long term.
Is naloxone a safe drug to use in reversing an overdose?
Absolutely. Naloxone is a very safe drug. I think the biggest risk from naloxone is it may initiate a withdrawal cycle. So a patient who's not breathing, who gets naloxone, they can wake up, they may have these symptoms of withdrawal. They could feel nauseous, they could throw up, but the alternative of them not breathing and potentially dying, I think when you weigh the two, it's really a pretty easy decision which way to go.
Absolutely. Now, we hear a lot about first responders and a lot of folks having access to naloxone. Do you think that's the best way to go to help save lives?
Yeah, no doubt. I think first responders, so paramedics, EMS responders, police, even lay people are carrying naloxone with them in case they may witness an overdose in a restaurant, a public place, a bathroom somewhere. If you have access to naloxone and you come upon someone who's stopped breathing, really it's absolutely life-saving. The sooner they start breathing, get oxygen to their brain, the less likely the chances that they're going to have a bad outcome.
Now, we've also been reading a lot about an increase in overdose deaths in Cook County especially. What are you seeing in terms of the illicit drugs that are available on the street now, and how much more potent they are than maybe something you would have seen in the past?
Yeah, that's been a very interesting story. In 2015, the Cook County Medical Examiner saw approximately 665 deaths, and that number ticked up to about 1,100 the year after. So the numbers just really exploded in an upward direction. What was really interesting about what we're seeing in Cook County is that even though the story nationally talks a lot about prescription opioids and pills, we found that our problem in Cook County is mostly a street drug problem. So what we're seeing as cause of death are either heroin or heroin that's mixed with this stuff called fentanyl. So fentanyl is a synthetic opioid. We believe it's made from out of the country in a laboratory where it's just cheaper to manufacture. It's far more potent, about 80 to 100 times more potent than the heroin. And we know that it's not coming from doctor's office, this fentanyl, but it's coming from abroad because we're getting all these different flavors of fentanyl, so what we call analogs, but they're just different varieties of it. And the medical examiner has identified a good number of them. So we're seeing about 80% of the deaths are related to street drugs, about 20% have been prescription pills.
Now, the Cook County Health and Hospital System, like you said, has seen a significant uptick in the number of patients who have needed emergency care related to opioid use or misuse. What is the health system doing to combat this epidemic?
Yeah, the health system is doing a lot. So the one thing that I'm mentioning is that we started this Naloxone Program. That's something that I've been involved with. We started in the emergency department, but now it's across the entire system. You can get naloxone throughout the hospital, through clinics, even at the jail it's being distributed. They've expanded these MAT, medication-assisted treatment services, so more patients can be cared for on a long-term, ongoing basis. In addition to the MAT clinic, which is staffed by specialists, we also are training more and more of our primary care doctors to do this office-based medication-assisted treatment so they can go to a family practice clinic and they can receive that care there. We're also expanding the type of testing we do at the hospital so we understand the patterns better. We've onboarded a bunch of recovery coaches that also can really, since they've walked the same road as a lot of our patients, they can really help them find housing and really understand the ins and outs of what they're going through and make referrals. So the system's doing a lot.
That's fantastic. What do you think people need to know about addiction in general?
Yeah, I think what people need to know is addiction cuts across socioeconomic and racial lines, and that it could affect anyone. In fact, I think it would be hard to find anyone that you know that has not either known someone or been personally affected by the opioid epidemic. It's become that widespread. So I think we all have to work as a community to destigmatize substance use disorder and really look at it as a medical problem, get folks into care, provide support to those people that we know they're in the situation, and help them with recovery. I think really destigmatizing substance use disorder is super important right now.
So, in the past, we've talked about addiction being a lifelong medical condition, just like heart disease or diabetes might be. What advice do you have for people who haven't sought treatment yet, who may be suffering from addiction? What advice would you have for them?
Yeah, and I think that that's exactly right. So I guess for the general public, I think exactly what you said is that it is a lifelong condition and it's got to be managed like you would high blood pressure, diabetes, asthma. For someone who's not going to care, realize that health systems like our own and doctors in general are really trying to respond to this epidemic very strongly right now. You should come in for care. We'd love to help you get attached to one of these programs for medication-assisted treatment or whatever would be appropriate for you. But we definitely encourage you to come in for care.
And if you are struggling with addiction and are looking to make an appointment with either a primary care doctor who can help get you started on medication-assisted treatment or a counselor or a recovery coach, you can call our patient support center at 312-864-0200 and make an appointment. So Dr. X, what is next in this opioid crisis? Where are we going to go from here? Do you think it's going to continue, or are some of the measures that we're putting in place going to have an immediate effect?
Yeah, I think that's a great question. I would say the things that I would see going forward is that we have to continue shoring up access to care. We have to make sure everyone has access to a doctor and to substance use treatment. I think we have a big road ahead of us to make sure that everybody can get access and also get into care. I think we still have a lot of barriers in the United States over that. I think that these drugs are extremely addicted, and we have to realize is that we have so many patients who already have this problem that are going to need ongoing care. So we're going to be working on this really for years to come in the future.
Sure. And it looks like we have a caller. Caller, please go ahead.
Sure. Hi, doctor. I was just wondering if I have opioids in my medicine cabinet, is there a place where I can throw those away so that I don't run the risk of someone stealing it or anything like that?
Thank you so much for calling. I'm so glad you asked that. Absolutely. There's a couple of options. Police stations now have drop boxes where you could take your pills there and you could dispose of them. You could look up on the internet exactly which police stations will do that. Also, pharmacies are actively taking back opioids as well. And that's such a great point. A lot of times folks have surgery and they get more opioid pills than they need, and you absolutely want to get them out of your house, especially if you have people in the house that might experiment or whatever. You just want to get them out of there. Thanks so much for calling.
Thank you. Do you think that's one of the biggest risks for people who may be at risk of developing an opioid use disorder, is just that easy access if there's extra pharmaceuticals laying around the house?
Oh, absolutely. I think that it's been pretty well known that if you have access to this and then if you start taking it for a period of time, that can definitely lead to addiction. If you're taking it for several weeks recreationally, you could begin developing some dependence. So really, people want to get it out of their cabinets. Another big thing that our health system is working on we're working on responsible prescribing guidelines. So as part of that, we're trying to get physicians to really prescribe only the amount that's going to be needed. In the ER, for example, we won't prescribe more than a 3-day supply unless it needs to go longer before you can get to see your specialist. And then after surgeries and other procedures, we're hoping to get the quantities that people leave home, to go home with to be less. Mm-hmm. So it's something that we're actively working on.
Now, we touched on this a little bit before, but should people be concerned if they get prescribed an opioid from their doctor?
Yeah, that's a great question. People really should not. If you have surgery, that really hurts a lot. And in the short term, right after the surgery, you really may need an opioid to get rid of the pain. The key is to be mindful that you don't want to be in the opioid for a long period of time. And when used appropriately for short periods of time, they really can improve quality of life. So people should not be afraid. Also, we're talking about fentanyl. Sometimes if you go to the hospital to get a broken bone relocated or another procedure, they may use fentanyl. I've heard from patients that have heard the news say, oh, I don't want that stuff. And I would say absolutely take it if you're at that setting and that your doctors want to use that. In the appropriate place, which is the hospital, these are extremely safe medications.
That's good to know. Now, one of the things that has also come out is that people who may be impacted by fentanyl don't necessarily know that they're taking it. It's being mixed in with some illicit drugs like heroin. It makes them even higher risk of an overdose. Is that right?
Yeah, that's exactly right. In fact, that's why I believe we're seeing such an increase in the number of street fatalities. That if someone goes out and they're buying heroin, or they think it's heroin, and then you actually get a drug that's 10 times as potent or 100 times as potent, you're more likely to die from that. So it's really you're playing with fire by using street drugs at this point in time right now. It's super dangerous.
Are there any policy recommendations that you have from your perspective? What can we do at a national level to help curb this misuse of opioids?
So I think the good news is I think there have been a lot that's been going on for actually several years now. The CDC just weighed in last year with guidelines for responsible prescribing. I think also the expansion of MAT nationally has been picked up by so many folks, supporting naloxone programs, the take-back programs, as the caller mentioned. These are all very important. Another thing that's linked is just access to care and us really having adequate support for those wraparound services, which are housing, work opportunities, etc. That's going to get people out of the cycle of addiction. So it's really just not the treatment of the substance use disorder alone, it's all the other issues that go around it as well.
Absolutely. So we just have a few minutes here to wrap up, but Dr. X, is there anything else you want to share about poison prevention in light of March Poison Prevention Month that you want to make sure that viewers know?
Yeah, I would say for Poison Prevention Week, please just be aware of the Poison Center. If you have any question or if there's any exposure, just call that number 800-222-1222. And then again, you might want to just take a look around your house, particularly if you have toddlers in the house. Check all cabinets, make sure any dangerous chemicals are put in a locked cabinet or something up high, and just make sure the environment is safe.
Excellent. Well, and then so there are two important numbers to remember: the Illinois Poison Center, 1-800-222-1222, and of course, if you need an appointment to see a medical provider, you can call the Cook County Health and Hospital System at 312-864-0200. Dr. X, thank you so much for being here today.
Thanks for having me.